na pasyente o 2 positibo na nag-umpisa tayo mag-contact tracing. Dito ngayon, we're talking about 5 individuals. Merong iba't ibang period of stay dito sa Pilipinas yung foreign nationals, tapos meron din mga iba't ibang pwestong pinuntahan. So, we need to be as extensive as possible so that we can try to trace everybody no, na nakasalamuhan itong mga taong to.
Sir, saan po posibleng nakuha nung 5th case yung infection, and may initial number na kayo ng na-contacts nyo na doon sa 2 cases na bago sa Pilipinas?
The contact tracing is ongoing. Okay, so we cannot give you a figure right now. We probably can tomorrow, if not Monday, what groups of people have been subjected to contact tracing. How the 5th case got the COVID-19, we really don't know, and that is the reason why we're doing contact tracing, is to be able to find out the source, if at all possible.
So yung galing yung 4th case, pagkagaling ng Pilipinas, bumalik ng Japan, anong area sa Japan siya nagpunta?
That's the lawyer. That's the male Filipino, 48-year-old. So again, the question is, Tokyo.
Sir, may we know of the profile nitong 5th case? Ano ho ba siya? Health worker ba siya? Yung sa San Juan po.
We don't have that information as of now, except that he is a 60-year-old male. 62-year-old male, I'm sorry. Okay? So that so far is the only available information. Other than those that I have already mentioned.
Do we have a recommendation to close down temporarily po itong prayer hall given na likely na doon niya nakuha yung COVID-19?
Dr. Ravi, please.
So that's why the secretary was asking for his contacts who've been there, if they are to contact the numbers, the hotline numbers that we asked. Because we want to establish whether there are other people who are having clinical signs and who are possibly infected. The mere presence of one confirmed case does not mean that we need to close down the prayer halls, right? We need to understand whether this was an isolated infection which happened somewhere in the community farm, somebody who was mildly symptomatic or asymptomatic, or whether there is a clustering of cases with his contacts. And that's what the services are, the RESU services are now looking into. Right now we don't have that information. And so once the situation is clear, I'm sure the department will make the appropriate decisions.
But as of now, is there any recommendation for the public to forego visiting this particular prayer hall?
There's no reason, because he's now in hospital. So unless we have evidence that there are other infected people, there is no evidence for us to say not to go there.
Good afternoon, Secretary. Just like to ask, what are the possible measures that you're going to strengthen since there's a possibility of local transmission? And about the Japanese national who stayed in 3 different hotels in Manila, what are the measures that the IATF task force will do about this one, and the contact tracing that will be done, since yung exposure po niya is medyo mas malawak po yung scope.
The 5th case. Yes, as we have said, the priority intervention is the contact tracing. And we'll have to wait for the results of the contact tracing and coordination with the local government units. But The first part of your question, what do we do now that we have seen a local case? Two, in fact. Like what I have said before, we address the issue at different levels of interventions. The surveillance, we've done that since January 4. It's not as if we're just doing it now that we've seen the 2 local cases. But as a matter of fact, it will be good to stress that since January 4, we have already heightened alert level for our Bureau of Quarantine. We have leveled up our capacity to do thermal scans. In fact, we have been able to procure 20 additional thermal scans for our Bureau of Quarantine sa lahat ng mga paliparan at sa mga pantalan. Then next, of course, would be at the level of the isolation, early detection of cases. And when we talk about this, what comes to mind is our laboratory capacity building that has begun since last week of January. If you recall, our tests were sent to Melbourne, Australia. And until about January 31st, we were able to establish our own testing capacity at the RITM. And I'm glad to let you know that at this point, we do have about 4,500 tests that we can perform. So we hope to increase the stocks of testing materials, the RNA primers, the reagents, and the extraction kits. Okay. Now, I have already thoroughly discussed the contact tracing. Let me go to best practice clinical management or case management. And this is why it's very important that our hospitals, not just the public hospitals, but the private hospitals as well, have been given the guidelines in terms of the clinical best practice management of individual cases of COVID infection. And also highlighting the importance of infection prevention and control measures. In fact, the WHO has sent experts to help us do an assessment of our first public hospitals insofar as their IPC is concerned, or infection prevention and control protocols are concerned. Which of course, this will be shared to the private hospitals para pareho yung level of quality of case management. And of course, the prevention intervention, I think you've been bombarded with the what is known as the non-pharmaceutical public health measures, such as hand washing, cough etiquette, social distancing, and other interventions that will strengthen the resistance of the individual so that if and when they do get the infection, this will be limited for the large part to mild cases. You see, it's very important that after the preventive measures, the mitigation measures must also be put in place, which means that, again, the best practice clinical management of individual cases of COVID-19 infection must be up to par, because we don't want them getting into a serious or critical conditions where the likelihood of death is increased. So we have to be very, very sure about our best clinical practice management.
Follow up no.
Sec, yung fourth case po ba nasa RITM din?
Fourth and fifth cases are both in RITM.
And they're both residents of Metro Manila po ba?
Yes, they are.
Sir, can we say kung ano pong area sa Metro Manila?
No.
Okay. Sir, yung fifth case, may information po na nagpapakita na rin po ng symptoms yung relatives. Can we confirm?
Would you like to answer that?
Yes, ma'am. Based on contact tracing and based from the initial investigations we've done last night and early this morning, we already have one relative which has been with the patient all throughout, has already experienced symptoms and is now with him in our referral hospital.
Nakauna na po ba siya, ma'am, ng specimen?
Yes, the patient had already been, the specimen was collected and we're just awaiting for results.
Okay. Ma'am, there's also information that the fifth case is a vendor in a shopping center. Can we confirm?
We do not have that information, ma'am.
Okay. Klaruhin ko lang po ulit, para po mas maintindihan ng ating mga kababayan, kailan po natin masasabi na may local transmission na po sa Pilipinas?
Well, as soon as we have more than one case, that should be a reasonable consideration as a basis for saying a local transmission is happening.
Thank you.
So, magandang hapon po. Ang question ko lang po dito sa Grand Cruise Ship, kung may napag-usapan na bang ilikas natin sila at saan po sila dadalhin? Kasi nga yung sa Kapas Tarlac, tumanggi na po yata silang dadalhin doon pa sa kanila yung any batch po ng mga repatriate po.
As of this time, we have not received any request for repatriation or any assistance. So I think that's all that we know as of now.
Ibig sabihin, maghihintay tayo, kanino tayo hingi ng repatriation
It will
sa cruise ship?
It will be through the DFA. They are the ones negotiating with this and talking with this cruise liner. And once given any development, then we will inform the media about this. Okay.
So sa ngayon wala pang place to Apo, yung pagdadalhan wala pa. Wala pang
Wala pang instruction or wala pang communication about that possibility. So that's all that we can say about that.
Ano pong ginagawa natin ngayong coordination doon sa cruise ship?
We have actually the interagency task force headed by the chair, Secretary Duque, and regularly they meet once a week. And if there are developments, even emergency meetings are called kung meron ng mga developments about these issues. So as of today, wala pa tayong nakikita o nare-receive na instruction or information about how we are going to handle our compatriots, overseas Filipino workers in that liner.
To Dr. Ravindra, sir. Sir, my concern is also with the thousands, hundreds of Filipino who are now stranded on a cruise ship in California. Do we have any protocol, or are we expecting same scenario as what happened in cruise ship in Yokohama, Japan?
We cannot comment at this point of time because we haven't the information on what's happening on the cruise ship. We have heard reports of a few cases there, but beyond that we don't have the information, and nor has there been any official communication with the DOH or with WHO.
Thank you.
Good afternoon po, Isa Umali from DCWB. Ngayon po na meron tayong new confirmed case ng COVID-19, for sure meron naman tayong mga kababayan na magwo-worry at bibili, hahanap ng mga face mask. Meron na po ba kayong solution dito? Thank you.
Ulit-ulitin ko, pagka wala naman na sakit, hindi naman kinakailangan magsuot ng face mask. Iwan na po natin yung mga face mask para po sa atin mga health workers na sila po talaga ang frontliners sa pangangalaga ng ating pong mga may sakit. So ako po ay nakikiusap, yung po mga nagbabalak na magsuot ng mask ay hindi po kinakailangan kung wala po kayong karamdaman. Ito po ay pwedeng isuot lamang kung meron kayong karamdaman, at kung may karamdaman naman kayo, huwag na po kayong gumala sa labas. Manatili na lamang kayo sa inyong mga tahanan at doon kayo mag-face mask para hindi naman mahawaan ang inyong mga kapamilya. So ulitin po natin, ang face mask ay para unang-una sa lahat ang ating pong mga healthcare workers.
Sir, you've mentioned earlier that the 48-year-old male is in stable condition. How about the 62-year-old male po? Ano po yung status?
As I have said, he is suffering from severe pneumonia.
Sir, kamusta na po yung mga naka-quarantine sa NCC? Meron po bang bagong may symptoms?
Thank you, sir. Actually, ngayon, if you will allow me, sir, to report the status of our overseas Filipinos now quarantined at this village in NCC. We are actually monitoring 459 people. 458 are those that came from Japan. Kasama na dito yung teams that were sent, the repatriation team. There are 13 of them. So actually, 440 ang crew, 5 passengers, and 13 repatriation team, 9 from the DOH and 4 from Department of Foreign Affairs. So ito yung 458. 459 yung minamonitor natin ngayon because one of the health personnel that we sent in to attend to their daily needs for the next 14 days, medyo nagkaroon ng sore throat. But we tested her at negative naman. So now that person is currently undergoing 14-day quarantine in the mother hospital niya. So far, okay ngayon. As of the total that we sent to the hospitals, 26 of those that we are watching were sent to the Eusebio Lingat. That's our first line of hospital. And among them, they were all negative. That's the good news. Walang nag-test ng positive. And among them, 15 are already discharged. They are back at the NCC. Only those 10 na currently are admitted, but they are all asymptomatic. And some of them are already negative. Some are still awaiting result kasi yung iba kahapon lang na-admit. So far, so good. They are happy, I think, because we are receiving feedback and letters or notes of gratitude for our Filipino people taking care of them.
Just to clarify, ilan po yung bagong PUI from NCC?
6 ang bagong referred kahapon. I don't know, I have to check. Yeah, 6 yung dinala ko as of kahapon. So, but the total is 25 all in all, yung nadala na sa hospital. And again, ito yung 6 na naghihintay ng result from RITM.
Last question on iPhone.
Sir, can you please confirm if the Muslim prayer hall is the Green Hills Masjid? And now my second question is, there's a spreading scare, a message circulating that the 5th case came from Cardinal Santos Hospital. And people there are already panicking na galing daw po kasi doon and he was transferred to RITM, referring to the 5th case po. How will you respond to this, sir?
Well, as I've said, we don't have that information. We cannot give you that information. So we'll keep it at that because of privacy considerations. We have to respect that. That is enshrined in our Constitution.
Thank you very much. So that concludes our press release for this morning.
Facility lang. Yung relative of the fifth case, nasa RATM din po ba? Isang relative lang po yung ino-observe or ilan po yung under observation niyo?
Yung kasama niya, yung kasakasama niya.
Secretary, yung respond po dun sa spreading scare, sorry. Yung respond po ng DOH sa spreading scare that the fifth case came from Cardinal Santos.
I cannot confirm. So let's leave it at that, okay?
Sir, may update na po sa Macau repatriation. Sir. Sir, may update na po sa Macau.